Welcome, everybody. I know we have students here because you guys are sitting way at the top and not near the bottom, and so it's all spread out. So hopefully we'll get some folks coming in today. But good evening, everyone. My name is Kavita Vanwada, and I have the privilege of serving as the founding dean of the New York-Presbyterian Iona School of Health Sciences. So it is my pleasure to have you all here for our fourth and final installment of the Symposium on Health and Well-Being for this year. So we will continue next year, and we'll get some dates out there. So in tonight's presentation, we want to talk about the future of the healthcare workforce, where it's going, what are its trends, how this industry is evolving. So this, I'm sure, is a great topic of interest to our students, especially those who will be graduating in just a few weeks. But to begin the evening, I would like to call to the stage our president, Dr. Seamus Carey, to provide a welcome.
Good evening, everyone, and thank you for being here. A special thank you to our partners at New York-Presbyterian and to Kavita and her team for making this series possible on health and well-being. These are the type of events that supplement the education that we offer to our students, and they provide the insights that we hope you can all carry forward to the great work that you do to provide outstanding healthcare and also to provide a first-class education that we strive for here at Iona. Tonight, as Kavita mentioned, this is the last event in this year's series, and one point of focus tonight is the future of healthcare and the future of how healthcare is evolving. And it's interesting that this is the end point of this academic year's series, but it's actually the stepping off point for our campus-wide series next year, which will be on the future of work. And we're focusing on that as a follow-up to this year's speaker series that we have conducted, which has focused on artificial intelligence, in particular its place in the evolution of education. We believe it's going to be transformative, and I suspect you believe that too about healthcare. So it's a really nice sort of segue that we have here tonight, that Shaun will focus on the future of work and the future of healthcare, and this will carry this forward into next year with our series on the future of work with a focus on artificial intelligence. So again, I'm incredibly grateful to all of you for being here, and I'm especially grateful to our friends from New York-Presbyterian for coming and sharing your insights, and in particular to Shaun. I mean, Shaun has been instrumental in the growth of our partnership with New York-Presbyterian and our School of Health Sciences. From the very beginning, he has been an unbelievably professional and gregarious partner to work with, and we couldn't be more grateful to Shaun for all he has done. So thank you, Shaun. Enjoy the evening.
Good evening, everyone. My name is Tricia Mulligan. I'm the Provost and Senior Vice President for Academic Affairs here at Iona University, and it's my great privilege and honor to introduce our keynote speaker this evening, Shaun Smith. Shaun is our Group Senior Vice President and Chief People and Culture Officer at New York-Presbyterian. As you would imagine, Shaun is a very busy individual and leads the organization's people strategy, overseeing human resources operations, talent acquisition, training, organizational development, employee relations, workforce health and safety, and diversity and inclusion. Shaun's had a really illustrious career. In 2012, he joined New York-Presbyterian Weill Cornell as the Vice President of Human Resources and has since provided strategic direction for HR across the system, supporting some 47,000 some odd employees across 10 hospitals and 200 plus clinics. With over 25 years of experience in HR, legal, and healthcare management, Shaun has held leadership roles at Memorial Sloan Kettering Cancer Center and Champlain Valley Physicians Hospital. Shaun has an MBA and a law degree from Pace University and has served as an adjunct professor and on various boards, including the Center for Community Alternatives, Upwardly Global, the Rogosin Institute, and START Treatment and Recovering Centers, as well as the Vice Chair of Pace University's Board of Trustees, although we're happy to kind of claim him here at Iona too. On a more personal note, as Dr. Carey just indicated, Shaun has been a tremendous partner to Iona in both the founding of the NYP Iona School of Health Sciences, engaging our faculty, and leadership, and creating bridges between the NYP team, including Mary Bodette and his many talented colleagues, many of whom are with us this evening, and Iona. We're most grateful for your collaboration, your insights, and your creativity, as well as your enthusiastic support. Welcome, Shaun.
I want to correct a few things. One, I've been in this field longer than 25 years, but it occurred to me we probably stopped counting at 25. That's the right thing. One of the great reasons why I'm so grateful to be here is not only is the fact that education and you as students of Iona are critical for our future, but this partnership really is critical. I cannot speak enough about the importance of it, and I do want to go back to the point when I heard from Dr. Stephen Coren, that's our CEO, who called me and said, we have an extraordinary opportunity to partner with an extraordinary school in Iona. That in fact, the work that we will do with Iona will not only be supportive for the community, but will be supportive for the work that NYP needs to really accomplish in the future. Let me just talk a bit first about just appreciation to President Seamus Carey. Thank you very much for your great introduction. Tricia, where is Tricia? Where'd she go? There you go. Thank you as well. Kavita, I can't say enough about Kavita. We spend maybe too much time together, but a part of what needs to happen when you're creating something great is to spend the time to do that. And of course, I want to honor your faculty. That in fact, when you think about the kind of work that goes into creating these programs that are going to help you and focus you in your future requires not only talents, but must be able to think about today, tomorrow, next week, 20 years from now. And I'm grateful for my faculty at Pace, where I've graduated, for all the work that they've done to have me here today. And that's really a long way to say, when you invest in your education, you're also investing in your career. And as we talk about the future, I want to talk about your future. All of our futures, actually. That as we actually think about the notion of preparation and opportunity, the work you're doing here at Iona is about preparing you for the future. Let me talk a little bit about my journey, because I happen to find it still fascinating to me, so I'll tell others, right? That in fact, a long time ago, I started really thinking about what my career was going to be like. And that within that particular reflection, I only knew two things. My parents wanted me to be a doctor. I'm clearly not a doctor, right? And then I knew my parents wanted me to be a lawyer. So it's just one of the two. So I am a lawyer. But what I've certainly realized over the years is that life is about passion. And if we can tap into that passion, it's going to make a significant difference within our own futures. And so the day I found my passion was the moment that I actually started working at Memorial Sloan Kettering in healthcare. And prior to that, for anybody who aspires to do things in the for-profit fields, I applaud you. It wasn't for me. I worked in some great organizations, but it didn't give me the heart that I wanted, which is the heart that I get to display in healthcare every single day, is about the caring we have for our patients and the ability through what I do every day that changes the life of someone who's actually a visitor or a patient within our hospital. There's no greater calling, I think, when you think about impact and you think about the opportunity to create that impact. So I want to applaud everybody here today that's in Iona's program. There are a few programs that we've been working on together. Nursing, obviously. Who's a nursing major in here? I was just at our Westchester facility, and I heard about some of you who were interning there today that you were heading here for this session. But nursing is obviously critical. Speech-language pathology. Who's in speech-language? There we go. Speech-language pathology. Wow, there are many more than nurses. Let me do the nurse do-over again. Nurses, put your hands up. Okay, there you go. Speech pathology. Wow. OT, mental health counseling, marriage and family therapy. In the room. Wonderful. I had some great opportunities to sit with some of your professors about the programs and what it actually means, and complementary, I should add, to the work that we do at New-York-Presbyterian. Nursing leadership. There's an MBA program here, right? And you know, or a master's program Who's in that program? MSN for nursing. Great. Just want to see who we're going to recruit, who's going to work for New York Presbyterian in the future. And I just want to brag for a moment, social work, launching in 25, lab sciences. I am really excited about lab sciences, and you'll know why in a moment. Radiology, and CRNAs. Now let me tell you why I'm excited about some of these other things. Clearly, again, my parents wanted me to be a doctor, right? They only knew two things. I was born in Jamaica. My mother was a school teacher. She wanted to be a doctor. So you naturally pick up the aspirations from your respective elders. But when I actually thought about sciences, I was terrible at it. I was really, really bad. I was so bad that they asked me to leave my first school. And I share that proudly because those are great moments of reflection when we think about our lives and our careers and what we can do and can't do. I can only be my best me, right? You can only be your best you. And if we're applying ourselves to the things we love, then we're going to get there. As Kavita and I talked about just the conversation today, the future of healthcare, doesn't it sound pretty loaded? Like healthcare is going somewhere, it's going to disappear and fall off a cliff somewhere? That's not going to happen. In fact, what I would say to you, healthcare has probably been the most complex that it's been ever and will become even more complex, right? Many of you here, even despite your majors, will no doubt gravitate to other things within healthcare, and you're going to hear that tonight from some of our panelists. But as we actually think about what is happening in this great place of health, reimbursements are changing. You read that every day, right? But probably don't completely understand what that could possibly mean to a healthcare entity, where when I was growing up just a few years ago, for sure, states would bail healthcare out, right? Bail healthcare organizations out. Now we're really at survival of the fittest. We need to have extraordinary people. We need to have extraordinary technology. We need to be thinking beyond what we're doing in terms of treatment or course of treatment today to try to continue through research to evolve and to be sure that we're thinking about the future needs of populations. We know that across everywhere, people are aging. That means there's going to be a huge burden on healthcare systems. Translate that, it means we need you. We need people who are going to be providing great care to our patients. Some of the things that we hear a lot from our teams are questions about AI. I'm sure you have your own questions. Who used ChatGPT today? Not as many as I thought would have used it today. But I raise it because there's this whole conversation going on, right? Anybody uses Copilot? Anybody uses other kinds of technology with AI in it? Technology at home, right? You know, we're using this at home, and we're in an era where there's an immediate need for gratification, right? Any Amazon shoppers in the room? All right. Anybody in here expect to order the package and have it this afternoon? Right? All of those things are still the same when you think about healthcare, right? Healthcare is a people-centered opportunity for some. It is a caring and a service from the perspective of most. But today we're talking about large competitiveness across the healthcare landscape, which really means systems are merging together, creating bigger systems. I won't talk about the New York competitors who are large systems, but what I would say is these systems are becoming more organized, more capable of leveraging data to do things that are very different. Who's studying data in school right now? Anybody's talking about data? Kavita, we have to have a conversation. You're not talking about data at all. But the reason why I actually mentioned that is, when you think about technology and you think about the cohort of all the data that you can have about people, a marketing person would tell you it also gives you more insight than you might possibly know, right? So what does AI do? What does technology doing? It's taking all that massive data and it's organizing for us. So I'm going to tell you my dream for healthcare in the future. We're going to be agile, that we'll be able to predict, which is happening today, diseases faster to be able to support people when they come in at the bedside. But what's more important when we think about this at large, we need experts. I'm looking at Kathy, who's an expert. It was Kathy today. But as we actually think about some of those things, the expert meets the powerhouse data that can do things faster, hopefully get right to the core of what we need for diagnosis, hopefully caring people faster in a complex system where reimbursements are stretched, where people might be essentially moved out of the hospital faster. And then there's, of course, outpatient services, ambulatory care kinds of services, right? And so you will see, and we're seeing now, movement to ambulatory care in many instances, right? So New York Presbyterian, what are we doing? I hope you know this. It's a test. We are building a, go ahead, say it. Yes, ambulatory surgery outpatient facility. It's called The One, if you're not familiar with that. That's going to be right here in White Plains, actually not far from here. And of course, you're familiar with our Westchester facility. Could everybody who works at Westchester put your hands up for a moment? These folks love Iona, let me tell you. I will say that. I heard that today, clearly, on many occasions. But the opportunity when we think about this, which I really want to talk to you all about, is what do I do when I graduate? How do I think about this? How do I think about care? How do I think about the work I'm going to do? And as we think about that in that same future, the notion of great collaboration is critical. Kavina and I had a conversation, and that was really around what I call the intersectionality of care. No role here in healthcare can survive alone. Nobody. Can't be a nurse working in your corner. Can't be a PA working in your corner. Can't be the lab tech. Well, you can be a lab tech working in your corner. But you actually need to communicate with people, right? You're part of the care system. And it's important for us to have, I told you I was going to talk about labs because no one knows what labs are. So it's important for people to have clinical experts who are actually doing the testing behind the scenes to be sure that that patient is well cared for, right? And that we know that diagnosis again and what's happening. And so I'm opening this door as we have the dialogue today, that a career isn't just a finite career. You don't finish school and end. You finish school and you start. And for most people here, they'll tell you the same thing. That I started, I learned some more, I did different things. If you're nursing, maybe you want to be with the babies that I was with today, but maybe you want to be in the ICU, right? And you may not know that when you graduate at first. You'll just know, I'm a nurse, yay. And when I graduated law school, I was like, why did I do that? I don't want to be a lawyer, right? And I say that in jest really to say, when you find your passion, nothing else matters. So I'm going to urge everybody here to not just think about the career that you're going to have with New York Presbyterian. Say it with me again. The career we're going to have with New York Presbyterian, but we're going to think about how our careers really get spawned from the place of interest, our passion, and the things that move us. And in all of these careers, again, this notion of what the future is going to be, your nurse is actually working with technology. Your lab tech is creating things that's really about the clinical care of the patients. If you're in IT and you're working with our Epic system, you're probably programming it to provide guidance to our teams. And if you are in any roles of the people we actually had the chance to experience today, you can do anything you want in healthcare. Because the opportunities are not only boundless, but that in fact new roles are being created every day as we try to think about the future in context. It does mean some roles are going to go away, not the ones that we talked about today, but it does mean that in many ways, the application of you in your role might lead you to something else, and something else, and something else. But that you're actually daring to ensure not only that you are focused on your purpose, but that you're actually thinking about the impact that you want to create in this great world that we live in. So one of the things I want to say when we talk about this is my advice to you, and my advice to everybody here, is think about healthcare not as a business, but as a service. It is a business in its true context. And I often point out that even those with marketing degrees can have a great career in our business. And that's one of the takeaways. You're going to meet panelists today that have come from all walks of careers, who actually brought their talents to New York-Presbyterian, but who I could actually for sure say could do almost anything you want. And while I've talked about hospitals, I'm sure Kavita wouldn't be happy or if I didn't actually just acknowledge that healthcare space is not just hospitals, that it's broader than that. And when we think about biotech firms, pharma, they're healthcare too. But the other thing we're actually seeing quite a bit of in healthcare is smaller entrepreneurial kinds of businesses or startups that are focused on healthcare practice that has not been as agile for hospitals. So I've talked to people a lot about Candid. I'm going to get braces. I'm telling you my business. And I could decide, I'm going to go to my dentist's office and I'm going to go and do 3 moles and I could go for many weeks. Convenience is going to be important. And that's a factor in healthcare, right? People want faster, they want great service, they want people who are paying attention to them. When I take my elderly parents, then you have me to deal with my parents. But that in fact, as we look forward in the near future, where we will have an exit from our workforce in significant proportions, where today I can tell you that we have today, 10% of our workforce could retire today, where the stats suggest that when you think about what's happening across New York in 2 to 3 years will be 61,000 people short of talent. Across the country, we're talking about 1 million people, right? And then I hope that you step back and think for a moment, I chose a great profession. Now what we need is the leaders, you, to be able to craft where healthcare should go in the future. And if you remember nothing else that I said today, the average person has 6 or 7 careers. 6 to 7 in their lifetime. That doesn't mean you're a nurse and not a nurse. Doesn't mean you're in social work or PT or any of those areas and not tomorrow. But what it means is, as people, we're going to have interests, and that interest goes beyond your first job. But when I think about the people who lead New York-Presbyterian, some of them are in this room, and I think about our plans for the future and who's going to lead our teams tomorrow, it's the people today that are going to lead tomorrow, and you are going to be part of what will be the evolution of healthcare and healthcare's practice for years to come. So this great question of cost meets excellent support and service, means hopefully the imperative that everyone has great care. That's not the case, right? But could be. That if we actually thinking about this in a very innovative way, who knows what we can create. But what we do know is, in our business, no one should be left behind. We're here to care for communities, and many people in this room, including me, won't sleep at night if we know that there's something we need to do that's about caring for the patient, and that's passion. So with that, what I will ask you, I think we're going to have some questions. I'm going to end here for now with just great appreciation for you just listening to me. My son doesn't listen to me, so you at least will listen to me. But that you're also taking the opportunity, I'm going to ask my recruiters in the room to raise your hands. So Mike, Mike's not a recruiter anymore, he's been promoted, but see, he's on to his 3rd career with us. But I want you to know who the NYP HR people are, if you could raise your hands so that at the end of the night, if you have questions, we'll be able to support you in thinking about those questions. And I know I said I was going to end, but I can't without one more thing. We hired, Jyoti, 2 years ago, 9,000 people. Last year 9,000. The year before was 7,800. Okay, 11,000. We had, of course, COVID and we were recovering, but on average today, we've got about 1,500 vacancies, right? And I just share that we're one of many hospitals. We probably have less vacancies than most hospitals. And you could see you've made a wise choice. You've made an extraordinary choice in healthcare. So please, I encourage you to think passion and to think about how your education prepares you for what you're going to do in the future. With that, I'll turn it over.
That was wonderful. I think you gave us a great picture. If you take anything away, you heard those numbers. They hired 9,000 people last year and 11,000 the year before. There is great need. 1 million positions across the U.S., right? And 60,000 in the state of New York. So I am, all of you that are going into health professions, this is a place to go into. So I hope you're happy with that. But again, thank you, Shaun, for setting us up for this conversation. And I'm very happy to have 3 panelists who are going to introduce themselves. But I think we're going to kind of talk further about the topic, which is what are the trends? And for all of you that are out there, what is it that you're going to be going into when you go into the healthcare workforce? What are the expectations? So I'm going to start with Jess to kind of introduce herself and tell us a little bit about you.
Thank you.
Your titles are on the screen there. So to be totally honest, some of the, I would like to know what some of those mean myself. So I'm sure our folks here, so tell us what you do, how you got into your position, and so forth. So I'd appreciate that.
Well, thanks for having me. Pleasure to be here with you all, and congratulations to all of you who are about to graduate. You have a really, as you heard from Shaun, a really wonderful career ahead of you, and excited to see all of the great things that you will do and the impacts that you will have. So if you saw on my bio, I am a registered nurse. I've been a nurse for 15 years. I started my career at NewYork-Presbyterian, and I still work at NewYork-Presbyterian, and so I think that really just shows how wonderful of an organization it is to be at and all of the different opportunities that you can have. I've had a large array of things that I've been involved in. I started as a bedside nurse. I worked on cardiac step-down. While I was practicing as a bedside nurse, I went to graduate school. Didn't really know exactly what I wanted to do, so I deduced what I didn't want to do to come up with what my future would look like. I went to school to be an adult gerontology clinical nurse specialist. And while I was in that, while I was in school, I recognized that I needed a little bit more of a background to be the most successful professional. And so I went to, for a year as a project manager for our quality and safety team. I practiced for about 4 years as an advanced practice nurse, including during the pandemic. I've worked as a director of nursing quality, which really impacts the quality of care that we deliver to our patients. And most recently, as you see in my title behind me, I'm the director of administration. I work with our executive vice president and chief operating officer for the entire New York Presbyterian system. Also can be compared to a chief of staff. And so I'm really working alongside of our COO, acting as an advocate, a sounding board, and kind of helping him through his day-to-day role, which is pretty large, as you can imagine. So as you've heard from my background, I've been in a large array of things. It's given me a lot of different experiences, and I'm excited that I'm joining all of these wonderful folks on the stage with me today, because I will be transitioning into a role within Westchester, so hopefully getting to work with some of you guys in the future.
Hi, I'm Tara Ritchie. I'm the Vice President of Operations and Planning at NewYork-Presbyterian Hospital, and I am thrilled to be here with you today, and mainly because, and I've told this to many people, I live in this town. I live right down the road, so I'm thrilled when I'm able to do things in our community. I'm mostly excited about being here tonight because something we were talking about with healthcare jobs around, in and around New York and across the country is right here in your own backyard. We have a significant amount of opportunity just up in White Plains. We are opening an ambulatory surgery center where we have a variety of opportunities for people in this room. We are looking to hire new grads. We are looking to pair the new grads with people who have tenure and other capabilities that they can share with the new grads coming on board. We have over 400 positions that are not only within New York-Presbyterian Hospital, but also with our partners at Columbia Doctors as well. How did I get into healthcare? I would say it's by mistake. But once I realized I was here, I realized that I love the mission-based work. So I have served in division administrator positions. As a matter of fact, my first division administrator position ever was in the division of nephrology. How many people here know what nephrology means? Okay, I am in a health sciences school, but there were some people who did not put up their hand, and I'll tell you that it was back in the day when I had to go and get a dictionary off a bookshelf and look it up to go into my interview. Study of kidneys, for those of you who did not raise your hand. So started off there in academic medicine and quickly fell in love with it. And we'll talk a little bit about that as we go through the panel and discussions later about community versus academic medicine. And you know, I've been very fortunate, came to New York for personal reasons, have been with New York-Presbyterian for over 18 years at this point, have had so many great opportunities I didn't even know I wanted. For example, a conversation I had with Shaun Smith at one point was, Tara, we need to get some organization and support and advocacy around the physician assistants at New York-Presbyterian. But Shaun, I'm not clinical and I'm not a physician assistant. That's fine. Opportunity. It ended up being very rewarding because, again, we're in an institution, much like what you're in today, where people love to teach, they love to share. There are great opportunities. You think you walk through one door and you have a direction, you feel very comfortable with it, other doors open. And so as you navigate your career in healthcare, what I would just share with everybody out here is that while you think you might be on one path, be open to other opportunities as that may present themselves. I never in a million years thought that I would have responsibility for an office supporting physician assistants. I never in a million years thought that I would be working on opening up an ambulatory surgery center in Westchester County, but this is where we are today, so I feel extremely fortunate to be here today and share that with you. I'm also really excited to see where all of you land.
Sarah, my name is Matt Baird. I'm the Vice President for Service Lines at NYP, something I just took on that role in the past 2 weeks, so the title up there is slightly out of date. I guess similar to the themes that Tara and Jess and Shaun were kind of talking about in terms of my journey, I grew up in Scotland, and if someone had told me when I was graduating my undergrad I would be here sort of 20 years talking to you, talking about healthcare, I don't know if I would have believed them. My undergraduate is in politics and law. That was what I studied. I went to grad school at Villanova, where I studied political science, public administration. And the way I kind of got into healthcare, I was moving back to the UK and I applied to work for the British government. And they had a program where you could go and work in the civil service and they assigned you to a department. So Tara said it was a mistake that she ended up in healthcare. For me, it was kind of luck. They assigned me to health. I worked in the health department. And so I started out working on health policy. I worked in a finance team. I worked in the health secretary's office. So if anyone's ever seen Veep, I was one of the people that kind of follows around the politicians. So that was a role I had. I worked in the NHS in London at a teaching hospital. And then about 13 years ago, I was moving back to the US and got a job at NYP. And during my time at NYP, I've had a few different roles. A lot of it's been in service line, and so to kind of explain that for folks, across NYP, we divide the hospital across different service lines. So there's oncology, cardiovascular, neurosciences, and we kind of organize the hospital around those key service lines. And so my role now, I oversee all the service lines. Previously, I had experience specifically in neuro, some in digestive, and then kind of to Shaun's point about startups and sort of other things earlier, for a short period I worked in a program at NYP where we worked with physicians who had ideas for new medical technologies. And it was kind of like working in a startup, but I was working for NYP and we worked with patent attorneys and we tried to get venture capital funding. And so, as a lot of people have kind of mentioned so far, I think one of the big things as you're thinking about your future career is just to be open to different opportunities, because the range of things that I've done in the past 20 plus years, I wouldn't have expected when I was graduating undergrad. So I'm definitely excited to be here. One other reason I'm excited to be here, I've always had a connection to Iona University. Iona is the middle name of my oldest daughter. Iona is an island in Scotland, so I've never actually been on the campus before, but Iona is a special name to me.
Well, that's great. That's great. See, small world. I think if I heard a theme there, it's be open. And, you know, I say that as well. I think even in my own career, even though it's primarily been academic, but it's still be open to the opportunities. So Jess, you talked about your journey. So, you know, can you talk about, because sometimes, you know, fear of change is always difficult for us where, oh my God, I don't think I can do that. So what do you think would be, you know, when did you realize, oh, I can do this? What did you do when you started on this new journey? You know, did you feel ready, I guess?
That's a great question.
I think.
It's a great question. Can you guys hear me? Nope. Oh, there we go.
Yeah.
It's a really great question. And so one of the pieces of advice that I would give to you, and part of what lended to this really diverse background that I have in my profession, is say yes to everything. There are going to be people who see strengths in you that you don't even know that you have, and they are tapping into you for a reason. And so when someone gives you an opportunity, you are naturally going to doubt yourself, because that's what change does to us. It makes us second guess. Are we capable? Are we ready to do that? But say yes, because at the end of the day, someone recognizes that you are going to be great at it. They will accept you for every question that you ask, and it's okay to fail. And so I think learning that as I went along and learning the lessons from my failures is really what helped me be successful in every change that I had made.
I think that's great. I mean, I think you do. You have to just have that confidence in yourself. So just a general question, and you all can choose to answer, or whatever, okay? So it's to all of you. But many of our students in this room are going to be graduating, you know, as I said, in May. And so it is difficult. They've been students, you know, many of them full-time students, and now they're going to go into the workforce. Can you provide them, you know, like, what are your recommendations for them to have that successful transition from going to be a student? You know, you can wear what you want, show up, and then, oh God, I got to show up at 8 o'clock every day and go to work. And, you know, so can you talk a little bit about that transition?
Is, I mean, in your studies, there's a lot of things you do in teams, but a lot of it is kind of your own studies. I think one of the big things in the workplace is recognizing that you're part of a team. And I think that's one of the big things whenever we're looking for people that we want to recruit, bring in to work with us. I think a lot of people are going to have the same academic background. They've all done well in school. I think the thing that sets people apart is the ability to work in a team. And there's so much interdependency in healthcare that no one can do anything on their own. And I think just being able to recognize that you're not going to be able to tackle everything without the support of others around you, and being able to be a person that can to work as part of a team, recognize how you can contribute, how you can get the best out of others. I think that's something that's really important. That's maybe a bit of an adjustment when you're going from looking at your own studies to being in the workforce.
And I would like to expand on what Matt was saying, and that's very well said about teamwork. When we, in addition to that, something that I am always looking for when I'm interviewing people or just talking to folks about what they want to do next is be curious, be interested. When people ask me questions that stump me, I really enjoy it because I love getting different perspectives. So I think coming into a new role, ask the questions, even if you think, oh, I mean, how many of you have thought this might be a dumb question, but just ask the question. People like when new people are coming on and they're interested. They like when people are asking those clarifying questions because that means you're also committed to what you just signed up for. I mean, as far as how to show up and what time to show up, that's all really based on who you report to and who you work with. You know, you also need to make sure, and I'm sure your families also reiterate this as well, you want to show up how, you know, your authentic self. You also want to be appropriate for the professional setting that you choose to work in. And so I think that taking those pieces into consideration are really important as you navigate this next step in your career.
Yeah, and just the last piece to that is, as a clinician, excellence is a choice. We have to show up and choose to be excellent every single day. And our patients will deserve that. They deserve the best version of you every single day. And so I think as you transition from student to professional, you now represent you. You are an extension of you. And choose to be excellent every single day, because if not for you, then for the patients and families that you serve.
That's really excellent advice. I mean, I think that it's really important. It is a transition when you're now becoming a professional in whatever area you're going into. So it is a difficult transition sometimes. But I did want to ask you a little bit, I mean, like I said, going back earlier about being open to all of these opportunities. So I wanted to talk a little bit, as I said, this is our fourth installment, and we had talked about AI, we talked about health justice, how important that is, and we also had a conversation, and it is a feature that we do here in our School of Health Sciences. We talk about interprofessional collaborative practice, and Matt, you talked about working on a team as a team. So, so those are topics that were selected because we know that these are some of the factors. So how do you see those, it could be other things, but those three as factors for these students to kind of think about as they enter the workforce? What is the impact of some of those?
So I think one thing Shaun talked about AI, I mean, that's a big topic at the moment. And I think one of our NYP meetings last year, one of the sort of physician leaders made a comment that was a radiologist. He said the AI is not going to replace radiologists, but radiologists that use AI will replace radiologists who don't. And I think that's a big thing to think about, that there's still going to need to be a human element in everything we do, but the AI is just going to supplement the way that we work and the way that we do things. And that if we don't kind of learn that quickly, then we're going to be the ones that replace. So it's not that AI is going to replace us and we're all going to be replaced by robots, but I think it's just how we use those tools and how we think about using those tools. And I think a lot of the different trends that are impacting healthcare at the moment, they kind of overlap. So Kavita, you mentioned around health justice and technology. One of the projects we were working on in the neuroservice line recently was with some of the new genetic testing that's available. They identified that the risk factors for having a secondary stroke after an initial stroke were dependent on different genetic makeup for the patients, and that there were different drugs that patients would respond to differently depending on their genetic makeup. And so one of the projects we were looking at was using more of the genetic testing to then identify and target so that we can get the right patients, the right drugs. And a lot of that would kind of link back to some of the underlying health disparities that would affect those communities if they were given the drugs that everyone else are given. So that's an example where technology is kind of helping with health equity. I think all these trends are kind of coming together in everything that we're doing.
At New York Presbyterian, one of the things that became very evident to me very early on was our clinical program development is quite comprehensive. So we recognize that we can't just bring in a world-class surgeon to do transplant procedures. There's a whole team that is behind the surgeon to help support the outcomes that we are desiring. So you can take that into any clinical service. If I'm thinking in terms of ENT or otolaryngology, speech path, very important. If I'm thinking in terms of stroke patients and having them on a speedy recovery, I'm thinking of OT. I'm thinking in terms of when you go in for any test and people want to know what your physicians or providers want to know what your results are so we can best treat you, it is based on what we're doing in that laboratory. So I just want everyone to really understand the different pieces, because at our organization, we often talk about the different pieces that help support those, those larger or more premier or marquee, if you will, topics. We understand the heartbeat behind the operation, and it's all the people who touch the patient's encounter, whether the patient sees them or not. this is how we lift up that patient experience and provide the best care to our patients, their families, and the communities in which we reside.
Yeah, so first I'll touch on the AI piece. There were headlines of nurses who were resisting artificial intelligence months ago. And I question that because AI is really all of the wonderful things that AI is being built around and tailored to is to help you do your job better, to help our patients have better access to efficient, high quality care. And so if you think about, if you do just a little bit of research, one of the really great things that we offer now is that we take tests that patients have had, AI analyzes it, and it helps better predict who's going to be at risk of a disease through a simple test of an EKG. And that's through the use of technology, that's through the use of AI. And without that, then that patient probably would have had a decreased life expectancy. They probably wouldn't get to spend that time with their family, their loved ones. And so really thinking about the benefits of AI, it's not to replace anybody because we're in the business of empathy, we're in the business of compassion, and technology doesn't replace that. Only you guys can provide that. And so learning to embrace the technology and getting on board quicker will actually just be your best friend. So another thing I say yes to everything. Say yes anytime anybody asks if you want to pilot a piece of technology, say yes, because the sooner you can be a part of the solutions to implement that, the better. The other thing is that AI is really reducing the amount of time it takes you to do some of the more administrative tasks that are going to live in our roles every single day. So documentation is an example. Pretty much everybody in this room, regardless of what your future holds, you will have to document something. AI is really going to help us reduce the amount of time that it takes to document, so you could spend more time doing the things that you want to do. As far as health justice is concerned, you will see that it's going to impact every bit of the patient care that you provide. I know that you had Dr. Yashara here, who is she spearheads our Dalio Center for Health Justice, and she's really been doing a lot of work on social determinants of health. And you will really see through your day-to-day care how all of that is going to be so important in the care that you deliver to your patients. So as an example, if we think about a patient with heart failure, you could have two patients, they have the exact same disease, but one could have an abundance of resources and the other could have none. And so even if you're thinking about educating them on a simple thing of like food, what food do they eat every single day? One of them might have access to whole foods, the other one might need to have takeout every single night. And so just really thinking about how that's going to impact your patient care is really going to be critical to the success of you as a professional, but really the care that you can deliver to your patients.
Absolutely. I mean, it's so holistic, right? That we use that word a lot in a lot of different things, but really is healthcare is very holistic, from the technology and as you said, the health justice piece of it. So I'm going to ask Tara to talk a little bit about this great new the building that is coming up, and especially this idea of ambulatory care, the based facilities, and because this is a trend with a lot of large hospital systems. So can you, first of all, tell the audience, I know some in the audience know what an ambulatory care facility is, but can you just kind of educate all of us in what is this type of facility, why there is a trend to have these types of facilities, and what are some of those advantages that we can talk about? So
Sure, great, I'm happy to. So let's start first with an ambulatory surgery center or in an ambulatory care center. This is a building that's in White Plains. We are going to open and close. The building will open in the morning on a Monday, and by the end of the Friday, the building will be closed. Every single night, every single day we will open at 7 a.m. and we will discharge our patients by 8 p.m. that same night. So we're only open Monday through Friday to start, and we will open our doors September 9th of 2025. So that's ambulatory care, where we do not have open or overnight stays. We don't have 23-hour observation. We need to make sure that the patients are being seen in our facility and appropriate in that setting so that we can safely discharge them to home the same day. So we are very excited at New York-Presbyterian to open the one. This facility is located right off of the 287 interchange, right off the Ann Hutchinson Parkway. It's a 225,000 square foot office building that we've converted into a space that is going to house about 10 operating rooms or procedure suites. We're also going to have 2 interventional radiology suites. We have over 20 physical therapy stations. We are going to host about 90 plus specialties through our faculty practice partnership with Columbia Doctors. We are serving both adults and pediatrics. We are opening 10 infusion bays, and we will expand up to 20 based on community need. And we are going to have a whole array of radiologic modalities that are going to be offered to our patients right on site. So why are we doing this? We are doing this because we recognize that here in Westchester, we have a lot of presence. However, we don't have it under one roof. And we believe it's really important to you and your families that we provide this one location where you are able to access these services, but also have access to Columbia Doctors without having to go into the city. One of the things that we learned post-COVID is that people don't really want to go into the city. People said, you know, enough with me going over the bridge, enough of me, you know, paying for parking. And we said, okay, let's bring the doctors out to you. Let's provide the care to you at a location that's convenient to you and your families at a time in which you want this care. And that has been our mission. So we've been working with our Columbia Doctors colleagues to make sure that we bring this to fruition. The campus is beautiful. When you drive up, there's a lot of great construction progress going on. And like I said, we are hiring fast and furiously, not only with the New-York-Presbyterian, but also at Columbia Doctors. And within the walls, one of the things that you were saying is, why ambulatory surgery? Well, with orthopedics, for example, when I first started in medicine, a total hip replacement required you to stay overnight, and you had an average length of stay of a couple of days. Well, now the thought is the moment we can get the patients up and out of bed, their outcomes are actually better. And so there are ways in which we are able to take certain patients and we're able to give that total hip replacement, and they are able to be discharged from the hospital and they can safely and effectively recuperate at home versus being in a hospital. We find that having the patients out of the hospital, as you know, will reduce risks of infection and otherwise. But I would also say that it's overall better for the recuperation of the patients. And so there's a whole host of different procedures that not so many years ago were inpatient that are moving out to the ambulatory setting.
Great, thank you. Yeah, I mean, I think that, yeah, no one wants to stay overnight in a hospital. So the more we can go, and if it's closest to us, and I'm one of those people, I don't like to go over the bridge.
Well, we'd love to have you.
Well, worse than that is the parking.
For wellness visits only and prevention checks.
So going back to kind of, I know the students are really interested because I think, you know, in our programs here in the School of Health Sciences, we do focus training our students in disciplinary content knowledge, which obviously they will need to, you know, to do their professions. What I would like to ask you all is, what are some of those behavioral skills, or I guess used to be called the soft skills? So what are some of those things that you really think would be very important for our students to keep in mind as they enter the workforce and be the top candidate for any position?
Yeah, absolutely. I think that's a really great question, and one that, depending on if this is your first career or second, you might not naturally think about. But the soft skills that I really think are so critically important is really the compassion and empathy that you bring every single day. Those are things that people can't really teach you, that you just will deliver naturally. You wouldn't be sitting in this seat, you wouldn't be graduating, you wouldn't have chosen this profession if it didn't come naturally to you. So deliver that every single day. The other thing is really figuring out your resilience. You'll be challenged every single day, mentally, physically, emotionally. Healthcare is a really difficult job in more ways than one. And so find your resilience, because that's something that, again, someone can't really teach you, but it's going to become up to you to figure out how resilient of a person you can be so you show up again as your best self each day. And then lastly, I think the last piece is your emotional intelligence, because again, you will be tried in every direction possible in some cases. And so your emotional intelligence is going to be a really important thing to bring to the table.
Yeah, I think one thing I touched on earlier around teamwork, I think it kind of links back to this as well, because in the workplace, you're working with others. I think it's really important to be kind of authentic and be your true self. Kind of Tara touched on that earlier. You spend a lot of time at work and you got to like the people that you work with. And so I think being open and building those relationships is really key, because I think the way that we can get things done is working with other people, working on the relationships, and I think that's really critical. I think another thing that's really important is also just kind of taking time for yourself, sort of self-care, and making sure that you're balancing between what you're doing at work and your personal life, because I think, as we kind of talked about, your whole self is there at work, but you need to make sure that you're kind of taking care of yourself outside work. So I coach my daughter's soccer teams, I have other things going on, and I think that helps to kind of have balance in what you're doing, and it's really important. And I think those are just some things that kind of help you be well-rounded. I think another thing that we've kind of touched on as well, that maybe people don't always think about, is just focusing on sort of ongoing learning and being open to keep learning, keep developing, being open to different opportunities. I think those are things that make sure that you can sort of be well-rounded and have the ability to take on those new opportunities when they come along.
Okay, so I'm going to ask you a question. I want all of you to answer that. So when you're looking through resumes or you're looking through applications, what is it that each of you individually look for to select somebody to be on your team?
It's a really great question, and I almost hesitate to share this with you, but I once actually called somebody in to interview them because they had on their resume that they were a nanny in the Canary Islands for a summer, and I wanted to hear all about it. So,
Make it interesting, I guess, huh?
It's
Very
being,
interesting.
It's being interesting, but if you've never really had that opportunity, I think that one of the things I would say about resumes is obviously be truthful. We understand that everyone has to start somewhere, but I also want to just express the power of networking. I think it's really important to get out there and to express what you're interested in. And you might not even know about the really neat opportunities that are out there simply because you might not have worked in a health system in the past. Shaun, you mentioned something like marketing. We have marketing in this big system we call NewYork-Presbyterian. We have a whole legal team. We have an investment arm. There are so many people that work in a hospital, and I never even knew that until I was a part of this large organization. So it's large and complex. So I would say that it gets a little less complex as you get out there, you start networking, you talk to people, you understand what their roles are, share what your interests are, because an opportunity might not present itself just at that moment, but somebody might have you in the back of their mind when other opportunities present themselves.
Yeah, I think, as Tara was saying, in terms of something that makes you stand out, because a lot of the time people are going to have similar academic experience, similar grades, but something that can kind of set you apart, and whether that's volunteering activities or other things that you do, just something that kind of makes you a little different from all the other resumes that are being seen. It could be different internships or other clinical rotations you've done, something that kind of sets you apart from the others, because I think it's things like that in amongst all the different applications that come through that can help people stand out, and just something that will help you be kind of noticed in the crowd is important.
Yeah, so truth be told, I don't spend a ton of time analyzing resumes because I have a wonderful HR and talent team to do that for us, and they give us a lot of really fantastic candidates. But I'll talk about, because you guys shared a little bit about on your resume what helps you stand out. But let's bypass that, because you'll eventually get to the interview stage. And for me, what I'm looking for as an interview is, to Matt's point, you may not have the clinical experience that, if this is your first career. But think of those examples through school about, Matt talked about teamwork. Think about those experiences in school about how you can demonstrate that you are a team player, that you are fair, that you are respectful, that you really hold those characteristics that define your character. Those are the things that I look for. Because again, your experiences may not set you apart from the rest, but who you are will. And so find stories and think about those stories when you're preparing for your interview that really help highlight and shine through who you are and what you're capable and what you could bring to the table each day.
The other thing I'd just like to pick up on in terms of the interview, something that as I kind of grew in my career and was interviewing for different roles, different positions, I began to think about more is that when you're interviewing, it's not just about you're trying to impress the other person to get the job. You need to feel a connection to the person you're interviewing with and the company or the organization you're going to work for. And I think that's something when I was starting in my career I didn't think about as much, but I think it is really important because, like we've kind of touched on, you spend a lot of time at work. You've got to like who you're working with. You've got to like the organization that you're working for, that you've got to identify with their vision and their values. And I think that's something that, as I was starting out in my career, I didn't think about as much, but I think it's something that's really important because as you're thinking about where you want to work, you want to make sure it's not just right for the employer, but it's right for you as well. So I think that's something to take into account too.
Absolutely. I mean, I know when I'm interviewing somebody, for a position here, it's not just about them impressing me. I have to do my job and make them want to come here. So absolutely, I think we have to think about that when we're interviewing, that we're also impressed. So Helena, can you change the slide? I just want to, we got a QR code that was provided by Mary and Jyoti here. And so if you students go ahead and do the QR code, basically it is a form to NYP so that they will have your information, right? And so when you graduate, possible career opportunities. So that's pretty exciting. That's a great opportunity. So whip out your phones now and take a picture of that QR code. Before I leave, because what's going to happen next, I have one more question for them, but I'm going to get off the stage and I'm going to have Shaun come and sit here. And we're going to have questions from the audience. So there is a mic down on this side. We'll pull it out. I'm going to do my best impression of Phil Donahue, but I'm sure some of you guys don't know who that is. I'm going to go up there and try to, get the mic to folks. But I want you to ask questions, especially our students. So you've got these folks here who have such expertise, and so please ask the questions. So as I leave, maybe I'll have Shaun answer this too. Knowing what you know now, what piece of advice would you be able to go back and give to yourself if you were starting your career?
Okay, well, I guess I'll think of this real quick. The advice to myself, I think I kind of covered a little bit about just saying yes to everything. There were times that I didn't say yes to things because I had self-doubt. And I think knowing what I know now and knowing what I'm capable of, I would have said yes to a whole lot more. And so I think going back to my 15 years ago entry into nursing profession self, I would say yes to a whole lot more.
As I'm thinking about, again, how I got into healthcare, and I'm thinking in terms of how this all came about, I think that one of the things I would tell my younger self is find what you love and make a career out of it. And I share that with you because I share this with, or my husband and I share this with our children, and we're both in mission-driven work, and we didn't really understand this common denominator until just a handful of years ago. But that's really a family mantra is, find what you love, make a career out of it, and whatever you are, be a good one. So I know I'm throwing out a lot of just corny sayings, but I really live by this, and I often think about it, and that is what I would tell my younger self is just go towards the mission and what makes you happy.
Yeah, I think similarly for me, I think it's about having the values that are important to you and not necessarily having a defined roadmap of you want to get to this position in 5 years and this position in 10 years, but you know what's important to you, you know what's guiding you, and then with that, as others have mentioned, kind of being open to where it's going to take you. And I think as long as you're kind of true to what's important to you, the actual job that you're doing, it might not be something you imagined, things might move in a different direction, but as long as you have something grounding you, then being open to those different opportunities is going to be really important.
So I got to say, these were all great responses. And so if you're talking to yourself years later, you probably have more than a sentence. So I want to say ditto, ditto, ditto. But I will also add, which I think is an important concept today, is that people are people. I think when I was in school, I would get really intimidated by folks. You know, I'd see these folks on stage, and I'd go, my gosh, I don't know that I can talk with them. And what I learned later on is we all have, believe it or not, the same feelings that you have when you're talking to them. I won't speak for you, but I will say sometimes I'm nervous talking to you, and you might not know that, right? You may not know what that connection is going to mean. And so what I take with me everywhere is, you know what? Everybody in this room is just like me. Everybody in this room, put your pants on one leg at a time, just like me. Everybody has fears. Everybody has something they want to do that they're very anxious about doing. But at the end of the day, we're people. And so I've learned to normalize that fact. I don't care who you are. You could be the president of so-and-so. You're a person. And if we can bring that together in just your ordinary conversation, it actually helps you to network differently and better. And networking is not taking someone's cards and never calling them again, right? It is not taking that card and sending a note with an expectation. I want to introduce you to this concept of quid pro quo. What are you giving in return for that relationship? And believe it or not, you have a lot to give. Every time I meet someone who's graduating, thinking about graduating, thinking about a program, my 12-year-old godson, I learn from every single day if we're going to allow ourselves to be people. So just remember that. We're all people. And this imposter syndrome that we sometimes have is really just a fallacy. That having a dialogue and walking and creating a connection that you're going to have years from now is worth so much more than someone handing you your first job. And that's an important lesson for all of us.
Wow, what great advice. No wonder you guys are where you are today. I mean, it's pretty. Okay, so questions. Oh, great. There's also a microphone down there, too, if others want to.
First of all, I want to say thank you. Thank you for enlightening us to the various possibilities.
Thanks.
But most important, that we are all persons and we are in this room helping not just each other, but for the bigger mission and the bigger cause. So thank you. My question was, we had a seminar recently. It was talking about MedFT. We don't have it at Iona right now, but it was a very interesting concept, the same concept of networking. And they mentioned the time that it takes for the doctor to come into the clinic, to see the patient, you're in the waiting room. That time was enough for them to have certain questions to ask them. And I forget the number, but it was a huge number that they prevented suicides, which would have otherwise not been detected if it was not for that therapist in the room. And from an MFT perspective, we think systems. So we are able to go beyond just the person, but into the systems of what is that they are lacking. So it could be a contextual factor. It could be just providing them with resources. But just having that in the room, along with the broader system of the other network of the professionals, helps every individual a lot more. So I'm not sure if that's part of the theme that NYP is also looking at when you're not looking at the one or any other of your facilities.
Right. Well, yeah, that's probably, Tara, it's probably a great question for me from a practice
I think
perspective.
that's wonderful, and thank you for shining a light on it, because you're right. So healthcare is not just, the physical body, it's also the mental well-being as well. So we have the construct of how we're putting together the one to deliver the best clinical services is under what we're calling centers of excellence, and we have 5. We have men's, women's, children's health, neurosciences, and cardiovascular health. We also have a very strong presence of oncology services as well. But if we're looking under women's health as an example, we know that there's a whole host of things that can affect and impact women's health, to include also the mental health component and the mental well-being component. So that is very much active, and we are discussing that, or we've included it in our overall planning, and we're discussing how we can not only have it at the one, but also having virtual visits as well for people who prefer that option. So we're trying to make sure, as I think you can hear it from me, is what is the patient preference and how do we best deliver those services and care that's needed.
Yeah.
Great, here's another.
I want to just thank you for that as well, because I think in a lot of cases, what you just highlighted is care isn't just clinical care. And I think for those on my team, sort of this opportunity is how do you humanize an experience and how do you connect to the thing that perhaps someone might miss. And I will say, when I think about horizontal education, the ability for us to build cross competencies, that it's important even for a physician to identify that there's something different about that person. And so just to amplify what Tara's saying, we have, in terms of our discipline, multi-modalities of care. Some of that is really ensuring that we're connecting the behavioral piece with the outcome. Or if you're working on a clinical issue or have a clinical issue, that we're connecting even notions of integrative medicine to this notion of clinical care. Thanks.
Yeah, I want to just expand about Vinny's question, comment. So we do have a marriage and family therapy program and a branch, separate area, but it is medical family therapy. So she described it very well, the idea of a therapist going in to get not only that clinical, physical, care, but also the mental and emotional aspects. So
that's right.
Thank you for bringing that up.
That's right. Kavita, I just want to actually say, because that's one of the things that you introduced us to that program, is that the competencies that you have in that program have cross-connection to many roles. You may not see it, it may not look exactly the way you might envision it, but you'll see it embedded in roles across our entity that could really leverage the competency that you bring.
Hi, my name is Eunice. I'm an OT first year student, I'm sorry. When you mentioned opening up the one, that sounds really exciting, and it kind of sparks a question in my mind. In my role as a patient, I've noticed that it's really hard to talk to a receptionist. And that is enough of a tension point for me to not go to a provider. And so I'm wondering, as you set up this new practice, how are you thinking about patient care holistically, from the point that somebody needs to make an appointment to the point that they go all the way home? Because I think that that's a really great way to extend those virtues of compassion and care.
So Eunice, it's almost like I planted you out there. And Eunice, as a mother of 3 and somebody who very much assists my husband for any of his healthcare needs as well, I agree with you, right? And so we want to make sure that the access is based on patient preference, right? And so we have a big initiative throughout our organization called Access to Care, and this is what they live and breathe. They look at all these data and metrics because we want to make sure that when patients are calling, they are talking to someone, they are getting the appointments when they want those appointments. We are also doing, especially for the one, really looking at all of the online appointment options. Any new physicians that are coming on site, which by the way, we're recruiting 51 MDs and about 15 nurse practitioners just to open up our facility within our Columbia Doctors partnership. All of those people from day one will be online. And I think that's also important for people because I don't know about your rock and roll lifestyle, but there are times with me, I'm like, oh, it's Saturday night. I need to make sure that I get this doctor's appointment. And I will go online on a Saturday night and make a doctor's appointment for somebody for the coming up week. So having those options and that accessibility is really important. We are also doing another differentiated experience that I think will be important for this room to understand. Many patients, if given an option to be seen sooner, would be seen then by a nurse practitioner or a physician assistant. We historically have not really consistently given that option. We are giving that option at the one, and it is something that we're working on as our foundations and our principles for our faculty practice space and all of the clinical offerings that we're providing.
So I can't help but comment, because this is a tech moment, right? And sort of when we think about the technology and the ability to really support many people who have different interests or hope, right? Our receptionist really is not the one scheduling that appointment anymore. They're scheduling the next visit or the after visit or something that you need to follow up on. And as Tara described this, it occurred to me that, you know, for my 85-year-old mother, I make all her appointments as well, and I never talk to anybody, ever. She rarely leaves the house. We do visits virtually. And when we're talking about healthcare and options for healthcare, people also can come in your home to do labs, right? So I'll use a mix of concierge medicine. And I'm really mentioning this to really say that the field is so broad. And you know, the concierge medicine piece, which is intriguing to me, because I'd never start there, it seemed artificial for me, is to call someone who's actually going to show up at my house, a PA, an NP, a physician, someone who's doing scanning at home. And I'm taking the time to say this because there are many people who would be afraid of the experience. And the question is, how do we normalize the experience? And I got to say, for experts like we have on this panel, the thoughtfulness that goes into that, also in how we think about the diversity of that patient and the access points of that patient, all then come together from a place of creating a construct that gives different avenues to people to do just that.
Hi, my name is Dr. McDermott. I'm a graduate. I graduated in 1970, went on to become a geriatrician for 40 plus years. You know, a lot of talk is about bells and whistles and the surgery centers and the basic radiology, et cetera. My concern is the lack of nursing emphasis in the nursing home world. And I'd be curious to hear what NYP/Iona, are they addressing this issue for the young students who might want to go into the geriatric world? Now, for telling them right away, though, that the money is not there. And that's a big issue with convalescent homes, and yet we need very well-trained students to take over. So I guess the question is, what is the possibility for a young lady or person who would like to go into geriatric world?
So I have the director of nursing at Iona University here. I've asked her, she's going to say something about that.
Hi, everyone. So to answer that question, what we are doing is having all of our students starting in the fall. We've had majority go through this year to extended care facilities. So, and really understand in their last semester to fully understand what that means, the outpatient, ambulatory, but also for the geriatric population, and also rehabilitation. We also have students cycling through there. It's either extended care facility, palliative care, hospice, and so there's a different settings, but that is our focus. So 50% will be really in either school health or another outpatient clinic, thinking about ambulatory when you're opening. But then the other 50% of those hours in the last semester is extended care facilities population. So we really want that to be focused, not just in acute care, and to really understand. Now, you are correct about the salaries are a little bit different. However, they'll see a different type of nursing, and hopefully they'll start in really understanding that type of nursing and liking it as well. So, keep on.
One other thing I would add related to the question is, for NYP, a lot of our focus is often on the inpatient side. One of the things that's kind of changing is around payment models, and so there's different payment models that the federal government they're exploring that have more accountability across the continuum of care, so that the payment is linked to not just the care in the hospital but beyond. So there's a new model that's rolling out next year, the team model, and there's for 5 different conditions. They're looking at how payment would be linked to not just the episode in the hospital but beyond. And so as part of that as the hospital, we need to work with external partners as we're discharging patients to long-term care facilities or rehab facilities. And we need to make sure that they're getting good care as they're moving out into the community. So I think that's one area where we're going to start getting more engaged, thinking about the partners that we're working with, the care that they're delivering, because ultimately the payment's going to be one across the board. And so we need to make sure that the right resources are in those facilities so that patients don't go to facility, they're not getting the right nursing care, and then they're readmitted back to the hospital. So I think with some of these changes in payment models, we're going to see some influence that hospitals are maybe going to get more involved with some of these other facilities to make sure it's a higher standard of care.
I'll just add that we have significant capabilities on the geriatric side, but we look at it mostly as an age-specific scenario, the competencies you need. I think you planted a question that I had a dialogue about a month ago. I think we need more. I think we need more skill sets. It's great to hear what Iona is doing. I think that that's the stat that I mentioned before. I talked about retirements, but really, in context, what we're really talking about is an aging population across, and we're going to have many more aging people, so it's a competency that's really critical. So we've been ramping up a lot in palliative care and all of those important pieces, but I think there's also what goes beyond that, and I only speak of the expertise of me and my mother and my 93-year-old dad, that the conversation even on how one talks to people with the level of dignity becomes an important part. And I want to just say that out loud, because this ability to do that with respect and dignity and to listen to that patient is often the part where at times I might be most frustrated. But I've got a team of people that are great all the time, that when I make that phone call, then I know that there's a team here to really support. So the takeaway from me, though, is we need to focus on that more, and I want to thank you for raising that today.
Any other questions?
Can I ask a question?
Of course.
Can you raise your hand if you're graduating this year or this semester? Amazing. Well, I want to just give a big shout out to all of you who are graduating. Congratulations on all that you've achieved thus far. I know school, I remember it like it was yesterday. It's no easy feat, so congratulations for all that you've accomplished. And we cannot wait for hopefully you to come join us at NewYork-Presbyterian, because you are the future of healthcare, so thank you.
Thank you all. Thank you. It's been great. So let me, as we bring this evening's symposium to a close, I really want to take a moment to say thank you to a lot of different people. First, Mr. Shaun Smith, sharing your invaluable expertise. Your leadership is clearly, we can clearly see it. So we are truly grateful that you took the time to be here with us today. I definitely want to thank these excellent panelists. We met before. They have just been so kind and open and giving of their time. I really, really do appreciate it, Jess, Tara, and Matt. I do want to shout out to Mary Bodette because she is NYP Senior Director of Career Strategy, and she's the one, she and I are on Zooms and calls and emails, because she is really, from her end, she's really worked to get all of the presenters for all of our presentations. So a big round of applause for all of the NYP. I also want to thank people from Iona that have been very helpful, and the biggest person is the person right there, Helena Giacino, because she does all of the logistics. So these flowers and the stage, and she does everything. She talks to the facility, so I very much want to thank her. I also want to shout out for our AV crew. We have Joseph doing an excellent job with technology, and we have Aiden who is taping this so that we can watch it again. So we definitely want to thank. And obviously everybody in the office, faculty that show up, our students. It's so important, I think, and we want the community. One of the things that when I started in this position about 2.5 years, almost 3 now, but it was to get just an interaction with the community, because as a School of Health Sciences, we have a very important job, right? We have several important jobs. One is we're training the next generation of healthcare providers. And so we are exposed to a lot of health sciences, and the community should actually benefit from our training. So I've always wanted to have kind of a speaker series such as this. And so it couldn't have been done without our wonderful academic partner, New York-Presbyterian. So it has been just wonderful. So thank you all for coming. If you've come to, this is your first one, but we're gonna have more. We've had 4, so keep coming to these presentations. And so we do this. You all get a wonderful gift from us. It's a cute little bag, if you haven't seen it. I'm gonna give all of you, and Mary, you get one of these too. So I'm gonna come over and get these. So I get to play Phil Donahue. I get to
Kavita,
be
as you
Santa.
hand out the bags, I actually want to just say a special thanks to Dr. Carey and Dr. Mulligan. You are awesome. Sherry, who actually was acknowledged just for the work in nursing. But I too want to thank Mary Baudette and Kavita, who's really done an extraordinary job. But there are people here too who make sure this happens every day. If my team could just raise your hands, including Jyoti Ray, our Chief Talent Officer. But I actually want to just say a huge shout out, not only to the panelists, but faculty, you rock. And I think when we think about what we need to accomplish and what you're doing, my hat's off to you. And I really mean that as someone who's very vested in the education system. Iona is an extraordinary place. And for the students who chose to be part of Iona, I think you made a wise decision. Your future is very bright. I look forward to engaging with you over time.
Great. Thank you so much. Again, thank you all. Have a wonderful evening. Don't forget, we're going to do this again next year. So come back.